Okay, let's briefly talk about gender differences in cardiovascular diseases. If you look at this chart, we see that the prevalence of heart or cardiovascular diseases are higher for men in all age groups. However, even though the prevalence for cardiovascular diseases remains lower for women in old age, but the percentages drastically increase as women approach old age, as you can see from this chart. And this chart tells the same story. The rates of cardiovascular diseases is very low for both sexes in their adult years, and it increased somewhat after middle age. The increase is greater for men, and even though the increase in rates of heart disease is higher for men, the increase is also noticeable for women, especially when they approach old age. So, why is that the case? And if we look at data from the UK, it's the same. It's pretty low in young adult years, somewhat increased in middle age, drastically and significantly increased for both sexes in old age, and the percentages of heart failure for women drastically increase after old age. So what's going on here? Regardless of whether it's the US or the UK or any country in the world, we can safely say that we see this pattern. So why do prevalence or rates of heart disease or cardiovascular diseases increase significantly for women after old age? It's the same in this chart. The incidence rates are pretty low before 65, and it increased after old age, and is significantly increased for women after old age. We see a noticeable change for women in cardiovascular diseases after old age, regardless of whether it is peripheral arterial disease, cardiac failure, stroke, and TIA, or coronary disease. We see a noticeable increase for women after old age. What happened? And we know women, they go through menopause, and menopause is going to cause a decline in follicular reserve in a woman's ovary. This in turn leads to estrogen decline. And we know estrogen has a protective effect against atherosclerosis. It means narrowing or hardening of the arteries. And because of that, if women have sufficient estrogen in their system, it can be protective against cardiovascular health. And this explains why we see a noticeable and drastic increase in cardiovascular or heart diseases for women after 65. And sometimes smoking, whether it is for men or women, It can destabilize the ability of estrogen. I'm sorry, this is for women, but we know smoking is not good for the heart. But for women in this case, if the lady smokes, it's going to further destabilize the ability of estrogen in vasodilation function. And this affects the ability of the blood vessels to relax. This can, in turn, increase the woman's risk for cardiovascular diseases.